On this Tuesday morning, if you haven't heard by now, the country's blood supply is low, really low. The American Red Cross declared their first ever national blood crisis. The group says they've seen a 62% drop in blood drives because of the pandemic and a 10% decline overall in donors. So for people at home who want to donate and are otherwise eligible, let's run through the top COVID questions when it comes to giving blood and blood products like plasma and platelets. For answers, we went to the American Red Cross and Dr. Grace Sesse, Medical Director of Innova Blood Donor Services. First, can you donate blood after getting the COVID vaccine or the booster? Well, that's true for all the vaccines and boosters currently approved in the U.S. Innova also accepts blood from AstraZeneca recipients and the Red Cross from Novavax and AstraZeneca as well. And there's no waiting period for any of those. Next question, can you donate blood after testing positive for COVID? Well, that's also true. For Innova, if you tested positive and you're symptomatic or are suspected of having COVID and are symptomatic, you can donate 10 days after the resolution of symptoms. If you're asymptomatic, you can donate 10 days after your positive COVID test. Dr. Sesse says they don't require proof of a negative test to donate. As for the Red Cross, they ask you to wait 14 days after symptoms resolve. If you had COVID or you think you did. Asymptomatic cases must wait 14 days after testing positive. Our final question, and this is an interesting one. Those who had COVID and were treated with monoclonal antibodies, do they need to wait before donating blood? Our experts say they do. They do have to wait 90 days before giving blood in that specific incident. Now that is verified. Do you have something you want verified? Those are the ways to reach me right there on your screen, so jot them down and send me your questions whenever you can.